professionally known as Four Legs. So today we have a very interesting program. It is said that there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, with the support from Amplify Change, brings it to you. They give us a campaign, Let's Speak Up campaign, which is a radio program. Obviously, they will be highlighting a number of those issues. Obviously, these are issues to do with HIV and AIDS, and also sexually transmitted infections, which are STIs, gender-based violence, unsafe abortion, and then obviously mental health as well, and many other issues affecting adolescents and young people from all walks of life. So today we begin this journey, and as we begin this journey today, we have two guests that are in the studio. Maybe for the sake of time, I give you the privilege to introduce yourself. I have a midwife, Nes Msonda. Give us your first name as we talk to the listeners. How are you?
Okay, my name's Msonda Kangwa, registered nurse midwife. I'm also a ZAGO advocate, advocating for sexual reproductive health. I'm based at Lubuto Clinic and Adolescent Health.
Oh, good. And then Aaron?
My name is Aaron Mwape. I'm the youth advocate for sexual reproductive health and rights here in Dola. Yes, so I'm based at Lubuto Clinic. That's the Lubuto Catchment area.
Oh, okay.
Yes. Under ZAGO.
Nice. Okay, so let's begin with just establishing this. Why sexual reproductive health? Any one of you can go first.
Okay, it is very important, as Aaron earlier mentioned. We're talking about sexual reproductive health and rights. These are the rights of the young people. We're talking about adolescents, meaning the age from 10 to 19, even including 25 years. The issues that are affecting these young people who are out there in the community, the young people. Yeah, so that is all about sexual reproductive health and rights, and also the rights that they have as young people.
Okay, so when we're talking about young people, what age group are we focusing on?
Okay, we're talking about 10 to 19, but we're also including up to 24 years, but initially it's 10 to 19 years.
24 nishiba karamba. People were reached.
Yeah.
Okay, so Aaron, talk to us about teenage pregnancy.
Teenage pregnancy in in our community, per se,
Kurubuto, for example.
Rubuto, it is very high. Not necessarily on Rubuto, so Masala, Nkwazi, far beyond Mushiri, also Kaloko. Young people, yes, we have those cases in our advocacy that when we go out there are most of the young people kusanga chori mbakali na 15 years kali pregnant na kwa tefu moli mbakali na 17 years. So now like turashita wonder why fret kirefe. So na ikula sana mu community. So that is the reason why ZAGO ishide ukwafu yafwe ama adolescent mu community. Ocho kubere Let's Speak Up campaign to reduce so that they should including our parents. That's the reason why we are here.
Oh, nice.
Yes.
So according to your research and assessment, what could be the reasons behind on the ground? Ngamle interact na ama teenagers. What leads them to get pregnant early?
Okay, just to come in on that question, mostly you find that these young people, especially a girl child, will talk about peer pressure. In the community where they're coming from, maybe school, you find that the friend will be bragging to say, my boyfriend bought me this and that, not knowing how that expensive phone came in, not knowing there was sex behind that things the friend had. So the friend will, if you want to get this phone, is to do this. So they'll end up having unprotected sex. At the end of the day, they'll get pregnant. And also, this alcohol abuse, which is there, and substance abuse. When someone is under the influence of alcohol, they're able to do anything. Even a young person is not even able to advocate to have safer sex. So you find at the end of the day, they'll fall pregnant. Yeah.
Yeah, wala we pressure, but I totally agree with you. It's one of the reasons. So Aaron Azago, apart from this is one of the programs that we're using to sensitize. Yes. But in the community, what else are you doing?
So in the community, we do have dialogue meetings with the parents and stakeholders, like general stakeholders, church leaders, teachers. Also, we have these young people into music. So we do have interaction with them sessions. So we have peer-to-peer. Also, we have school outreach programs whereby we go there, we start giving out information there. So as peer educators and Zago advocates, youths, when we go there, we do ensure that we give accurate information to them. So these are the strategies that we use most of the time. And
they've yielded results, I'm sure.
Yes, the positive results are coming out. So we're trying also to engage the parents, the children's parents, because most of the adolescents, what we've noted is that most of the parents, they don't have enough time to their children. When we are interacting, if you are to do so as a journalist, the side research, you agree with me that abenga afya shibali wa busy. Udabo mwana bamwana fya wabukashani. Okay, na kunchito.
Yeah, inenjisa 04.
If 0.6. So in that time afya shibere. Tabe shibe frets kapangana.
Yeah, so I understand you.
And mkombo no moto aba nangu mayad. Te mkombo lfemweka. Mayad. Kusanga cho mwana wapa ne barimbi. Ali mufwa uli na 15 years. Alikuwa ataka boyfriend. Then alishipa fiance. Afya shimba ndefa umwana complain afya mala. So for twasanga. So I think tulinge tuombela pampadio.
Nice. Now Vanessa, what are the risk factors for teenage pregnancy?
Okay, so before I even talk about the risk factors, we're saying teen pregnancy. This is when a young person or a female who is between 13 to 19, even 10 years, has fallen pregnant. So the effects of this pregnancy on this young person, we are saying, one, this young person who face a lot of health issues will start with a young person will start developing high blood pressure, because this is a young person, the body is not yet fully developed, they don't know what's happening with their body. So you find that they'll start developing high blood pressure, which we call preeclampsia, the blood pressure which sets in when a young person or someone who is pregnant start experiencing raised blood pressure. We're also talking about there will be complication during delivery, because this is a young person. We're saying the pelvis is not yet fully developed. So there will be that obstructed labor. When a person is pregnant, normally a baby has to be born through a birth canal. So now we're talking of a person who is 13 years old, 15 years old, who is pregnant. How is the baby going to pass on that passage? So you find that there will be obstructed labor. At the end of the day, you find that the baby has some complication during delivery. Others, it may even cause neonatal death, whereby a baby is born and die just after delivery, because this child is born from a mother who is not yet fully developed. And it also affects the baby. Some of the effects, you find that this baby will be a low birth weight baby, whereby you find that the pregnancy has reached term, 9 months, but baby afina at 1.9 kg, because that mother was not ready to be a mother. The body is not yet fully developed, and they have nutritional effects, because we are saying the unborn baby is sharing the nutrition with the mother. So you find that this mother doesn't even know what's happening. As normal as others, but there are certain nutrition that they should consider when they are pregnant. But as a young person, that's not an issue. So a lot of things set in. This young baby will also affected. There will be malnutrition in the baby, because you find that this baby is born from a mother who is 13 years. Can a 13-year-old take care of the child? You find that I've experienced, my cousin had a child at the age of 14. So what used to happen, like after she delivered, when they call her, come and breastfeed the baby, she will run away. So meaning this child is being deprived of nutrition that the baby is supposed to get. At the end of the day, these babies are malnourished. Yeah, so those are some of the effects of a young person falling pregnant.
And those are some of the risks. So when you come into contact, you as a midwife, what do you really tell these teenagers?
Okay, so what usually happen, this time what we have done is, when these mothers come to book for antenatal, in other facilities, we have set to say a young person between 10 to 19, they have a day to book for antenatal, because we don't want that intimidation from, we don't want that. So what we've done, we've set different days when young people come to book for antenatal clinic. And when they come for antenatal clinic, we'll make sure we get the phone number, we'll get the address, we'll get the necessary information from this young person, and the follow-up, they'll be the times they'll be coming to the facility is different from an older person, because we want to be monitoring this mother. How is the health of this mother? How is the baby developing of this mother? So we initially give them a shorter period of time to be coming back to the facility, because we have what we call the youth-friendly spaces. Okay. This is the space where young people are attended to. Yeah, so once this mother is booked, they will be coming to the youth-friendly space. There we have a nurse. Sometimes even me as a midwife, we are found there. So we usually screen these young mothers. We usually advise them. If it means following up, we even follow up from their homes where they're coming from. We talk to their parents, whoever the guardian is taking care of them, so that we don't have those complications or those risks to come in this young mother.
Okay. Yeah. So Aaron, from your advocacy point of view as Zago,
yes,
in terms of statistics, do you have maybe a figure, like from a certain age to maybe say this month it was discovered that abakashana abadinemyaka no abadi 200 they had fallen pregnant?
Oh yeah. Okay, as an advocate, as the youth advocate for SRHR, the statistics are there. If we were
are they alarming, or would you say now equal rate, or it's reducing?
No, actually, as for now, with this one, Zambia Association of Gynecologists and Obstetrician is trying to address this issue for the young people, because when we look at the statistics for the last year, 2024, Zambia, I think that it was 28%.
28%?
Yes, 28%. That's
a huge percentage.
Yeah, yes, that's a huge percentage. So now if we are not advocating, then we are doing nothing. So that's the reason why Zago is there to address the issue. So when we go there, like in the community, we advocates, as Zago doesn't work in isolation, works hand in hand with police, also with Zambia Police, with Minister of Health, also with other institutions.
Yeah, because Zambia Police, obviously, those are issues of defilement.
Yes. So now, when you look the Zago itself, it's also other partners, including the fair youth-based organizations. Zago always collaborate with them. So they have their own report. Also, as advocates, when we are going there, we do ask, is these things really happening? If things are not happening, okay, things are not happening. Let's identify the hotspot. So the statistics are there. Also, under Minister of Health, if you are to go to Minister of Health, right now we are speaking, we're outside from the clinic or the hospital.
Yes.
It is a sad story. It's a sad story. Most of these young people, do you know that most of the young people, they do abort once they fall pregnant without their parents knowing? Do you know that?
Yeah. Anyway, those are issues
you understand? Yeah. So as an advocate, that is the reason why we are there. Want to address this new HIV infection. Yeah, we've got border. We have Sakanya border. We've got also Kasumbarese in the Copper Belt. Also, we have Kipushi border. Here, among people that we do see people on transit, at times they want to race the truck drivers. It's here. And if you were to see along the road, there are houses. and some of the young people are careless. So us as an advocate, we want to address issues of HIV and AIDS, STIs, and other infections to the young people. Teenage pregnancies is high. At times, when people are not paying attention, they might think things are not happening. Some of these so-called, let me say this, I know other people there, they might feel offended. Those who call themselves as old people, they are the one who are doing it. That's the supplies.
Do you go to church?
Yes, I'm a Christian. I'm a Christian. May I go to church? I'm a Christian. I'm a Christian. I support every religion.
Okay.
Yes.
Yeah, no, I was just getting your names. Okay, so Madam Sonda, in terms of response from the parents, since apart from you being a midwife, you're also part of Zago, how has been the response? Because they play a key role.
Yeah, as Aaron has earlier mentioned, to say we hold some stakeholder meetings.
Yes.
Where we involve parents of these young people in the community. We get from the community where they are coming from. We involve those parents. We talk to them. Umwana send information from home. That's the first teacher who gives information to a young child.
But obviously, for argument's sake, nowadays we have these phones, where people are watching stuff on the internet, and and people that have been exposed for doing evil things on the internet are young ones. I mean, about 2 penny.
That's what. Okay, so what we usually do when we involve these parents, we talk to them. How we interact. How do you talk to your child?
To your child.
When you're giving information to a young person, you're calling a spade a spade. Or something. This time you call a spade a spade. When you have unprotected sex, it's either HIV or other STIs infection. These parents, they need to talk to these young ones. They need to monitor them. What are they doing? Like outside. There was a time I went out, Padola Hiomo. There's a swimming pool behind there. Then it was around 11. A young person was very drunk at a Fumine Mukansensh. So I tried to ask her, touch the fence. A young girl, atoloka fence anwa ara wekera yengire banyatabeshi beno for alechita, because these parents, they are not concerned about how these children are behaving, what's really happening. Efo beshira mukufenta twakwete shani ifumo yo wikala fe munganda, but they don't know what abana abara batashani bala bafumamo. So you find that we are encouraging parents to just have a little time with their children. Ule ikala shani. As the time we used to grow, my mom used to ask me, do you have a boyfriend? So what do you talk about with your boyfriend? She was a friend to me, such that now what a problem in a relationship, I would confront my mother, because she used to tell me what society is all about. When you have sex and protect sex, what will come out? So we are encouraging these mothers, these parents in the community to talk to their children, to be open to them, so that when they have issues, they're able to be open to them. Yeah.
Okay. So let's open the phone lines now, just to check if our listeners have got issues they want to clarify with regards to Zago, peer pressure, and Aoko has been mentioned. I don't know why.
Yeah, guys, people would say down
that's one of the factors.
Yeah.
Plus 260-212-617140. That's the number that you can use in case you have any comment, contribution to what we are discussing on Health Talk. Today we are dealing with young ones. So maybe even before we even pick the phone lines, don't you think maybe also the approach of involving boys as you talk to these teenagers about these things will also help reduce the numbers? Yes.
Yes, on that one, as we do.
Okay.
When we are having sessions, we do. So as advocates, we always ensure that we involve everyone. We always remember, leave no one behind.
Okay.
As we are doing the advocacy, we always remember leave no one behind.
No,
Because if we leave a boy child, it becomes an issue.
Because kind of chumfo ya chibasana prominent. No, these girls.
You know for why turandira abana kashi apa yari be yakaba ngatwa ikonka buno sana ira muneke yanka bachari be yakaba one turosha teenage pregnancies nama other infectious STIs, yes. So number ababa more affected, ababa vulnerable bana ngamarosha padi bana kashi inena raisa ninkwata zati imuzike uriara ponyo mukoshi so yamureterera zari ebara muri mvua cho kwa afya secretary. So we are trying to address so that we balance the gender.
Okay.
Yes.
The +2602126174140 in case you have any comment or contribution on what we are discussing today. Obviously we are discussing something that involves young ones, and I'm glad that we've actually highlighted on a number of issues. But Vanessa, before we wait for those calls to come, okay. I know that I think it's a well-known fact that when the economy is biting, people are prone to make mistakes that are avoidable. So here is a young girl, panga ndari mbitapawa 3 meals a day. So akumanya baron barakwata ka 5 zari karaka zari bampera rimba ya pera banyina bashitamo something bonse bari apanganda. So how do you tackle such challenges?
Okay, you know that is very high. One of the leading issues to teen pregnancy is poverty. Where the community are coming from. I really interact with these young ones. You know, they will be open. If you are so friendly to them, you are interacting with them, they will be so open to you. So you ask them, nishwa kwa tide fuma upangande fya kuli kushupa. So kwa finenga waya walete mpia at the end of the day wakupere mpia. But as we are saying as Zago advocates, we go into the community. We sensitize to say, if you can't abstain, please condomize. Or we're even providing family planning from our youth-friendly spaces where we're giving these young ones, because it's a fact they are sexually active and we can't run away. So for us to prevent this teen pregnancy, we're providing family planning in our youth-friendly spaces in all the clinics. It's not only Lubuto. Yonzama clinics, they are providing family planning to young people. Hello, this time they only have their own space. Okay.
Somebody on the line. Okay. Let's pick this one, Oliver. Good morning. Oh, unfortunately, we lost you. +2602126174140. That's the number, just in case you have a question, comment, or contribution. Today, we are dealing with a very sensitive topic, especially that it involves our young ones. So, sorry, before I cut you short, you were on the floor.
Yeah, so we're saying this teen pregnancy can be prevented. We're talking of poverty that is there in the community, leading to these young ones having sex.
Especially Kantolombo.
Sana. So we tell them, if you can't abstain, use a condom or use family planning. Turana mu community na send them a condom. We're going around interacting with these young people with this campaign which has come with Zago Let's Speak Up campaign. Mostly now this time, but every month at least we are having activities na maskuru tulaya. But at school we don't talk about family planning, we only talk about abstinence. You know, it's not legal for Ministry of Education to talk about family planning, but we talk about abstinence. If you have more questions about maskuru tulaya, but come to the facility. If you have issues to talk about, come so that we discuss. So we are doing our best. We are trying what we can do so that we just reduce on this teen pregnancy, because it's not only affecting her, you know, even school-wise. This girl is in grade 8. They will drop out of school. They will need to take care of their child, meaning their education will be something will be affected, meaning the profession. Maybe someone wanted to be somebody, but because of that child that has come in, maybe with the grandmother, and it's not easy to leave your child with your grandmother. So a lot of things come in, but we are trying our best as Zago advocates to advocate for these sexual reproductive rights to the young people.
Okay. Looking at that, we don't have phone calls coming through. Aaron, what message do you want our teenagers to take home from this conversation?
I think from this conversation, let me be honest. In our past street, past street open our power baiche. I'm adolescent. Okay, necessary. Let's not call them junkies because we are trying to address this issue.
Yes.
Because if we call them junkie, bambari kwata ama mental health issue, whatever I'm discouraging. Junkie. So we're trying to address that as well. So the take home message is very simple. Let's abstain. Let's avoid having bad conversation.
What do you mean when you say bad conversation?
What I mean is that, young people, like there's this issue that is trending at the moment. The Lusaka youths, the 2000, the 2-pin one. Yeah. You see, right? So now, for me, I feel it's not necessary for I to start discussing about that issue. I have to be in an environment where I'm able to talk about positive issues. So like currently so far, the parents, they don't have enough time to their children. Why? Because of they are too busy.
Okay.
So now we want to address this issue in telling the adolescent that
yes,
let's try by all means to stay away from sex. Our parents, they may not know that we are doing it, but we are doing it. So let's stop. Those who are still in schools, also universities.
Yes.
We've got higher learning institutions. Like we have universities such as those universities. Those students, they're having sex out there. Yes. Varumi.
Mwadawati ekala nomukashana mu room.
Mwamone yasoka ma boarding house. So we are trying to. So we are telling them this take home message. Your future is in your hand. Your parents, they've done your part. They've done your part 100%, but it's up to you to make it. To utilize the opportunity
that has been given to you.
Some of the adolescents, they are well privileged. Some they've never slept without eating. You understand? Some they've never liked anything, but through bad company, bad associates. That is the reason why they're indulging that. So their take-home message: find good people, find good advisors. If your parents can't advise you, go to someone whom you trust, who can advise you positively. Because once ngakwatefumo, adolescent.
Okay, my phone is flashing. What are your thoughts? Right. Oliver, let's pick this one. Good morning. Hello?
Good morning.
Hello, good morning. Unfortunately, I'm dropping calls. I don't know why. +26021261740. There's another one. Oliver, let's pick this one. Good morning. Hello. Okay. You can finish your thought.
Yeah. So once ngakwatefumo, iskuru lyako nishilyaonaika. Bambi barabaseka mu community. Mwali ba stigma na discrimination hivi sana. Hivi. So ngawolefwa which they avoid as adolescent mu community. Chitefiri right. Avoid. Inshitayo bekafika kesa mbokura kumana na aba mu kambo kwatana to boyfriend.
Okay.
Yes.
So, madam, what's the take home from the medical perspective? What message should these young ones keep in mind?
Okay, take home message is I'll advise the young people, please, if you have an issue related to sexual reproductive health, you can visit any nearest clinic. We have youth-friendly spaces where we deal with teen pregnancy, drug abuse, mental health related issues, family planning, and other issues that are related to young people. So my advice is, if you can't talk to your parent, please come to these youth-friendly spaces. You find us, you find your fellow peers there to talk to. There are young people who are found there. You can tell them your issues and we are there to help you. If it's something that is beyond us, we usually refer you to the people who can help you. But as Zago advocates, we are doing our best. Please visit us to any nearest clinic, any nearest facility. We'll give you the help. Yeah.
Okay. So in case I want to join this Zago, how do I do it? Who do I contact?
You want to be...
You want to become the advocate.
The
You're most welcome. You're most welcome. Actually, you're most welcome.
I think their email there's a number for Zago, I guess. Yeah.
No.
So you can contact that number.
Actually, also, on addition, you can also follow us on Facebook. Via Facebook, you can type Zago. There on Facebook, you find us. You can ask any health issues related.
Yeah.
Just right there on Facebook, or maybe on website. You can follow us there. They're not only that. Since us, we are working from Rubuto community, you can come at Rubuto Clinic. Ask for the focal point person, or per se the coordinator for the youth. So ask the youth-friendly corner. Oh, where is the youth-friendly corner? Everyone at that clinic will show you. If you are to go maybe to New Masara Clinic, you ask, maybe you want to be part of this campaign, Let's Pick Up campaign. You come at New Masara, you ask for the young people. So like every clinic, we have youth-friendly space and the young people. So everyone is welcome.
Okay, thank you very much. I think you've been very insightful in the way you've brought out this information, and I can only hope and pray that our young ones, they got your message, and obviously they will stick to better living conditions, avoid certain things.
Yes. They have to. They have to avoid.
Yeah, they have to. Okay, so this is where we come to the end of this edition of our Health Talk. Please join us next week, Saturday, from 11 through to 12 with another exciting edition. For now, we are out. Bye-bye.
You are watching and listening to Sun FM TV on Channel 91 on Topstar and radio on 88.5